Hello, I'm Sarah Sangster. I'm an assistant professor in the Department of Psychology. So some of my research, or my particular research focus, is in the area of reproductive psychology. So some of the questions that I ask in my research, or that reproductive psychology focuses on, are things like how people decide about when they want to be a parent, or if they want to be a parent at all, and trying to understand the psychology that underlies changing trends in when people have children or how people decide to remain child-free. I'm also interested in cultural factors, how cultural factors influence our beliefs about reproductive issues. So for example, how news media frame issues like infertility and how that framing impacts our beliefs about reproductive issues like infertility. I study attitudes towards reproductive issues like abortion. So things like how social perspective and gender are related to attitudes towards abortion. So for example, finding things like women but not men judge the advisability of abortion differently for ourselves than for another. I also study attitudes towards reproductive care providers. So things like, what are the widely held beliefs or stereotypes about midwives versus obstetricians that might impact why somebody chooses those care providers for their reproductive health care? I also study parenting experiences. So for example, what it's like to raise a child with Down syndrome and how that experience varies from person to person. Experiences in the reproductive healthcare system. So for example, a paper that's currently under review is about what it's like to receive a Down syndrome determination in Saskatchewan and how that experience can be improved. This area of research has sort of made me focus more and more on the psychological experience of uncertainty when it comes to reproductive issues and how reproductive healthcare providers can best mitigate or lower the anxiety that can accompany uncertainty in these situations. So that's my particular research focus, is reproductive psychology. But I'll supervise an honors thesis in any of the sort of broad areas of social psychology. So some of the classic topics in social psychology are things like social cognition and social perception. So how we think in the social world, the self and identity in the social world. So what counts as me, or how we develop our me-ness or our I-ness in the social world. Social factors related to prosocial or helping behavior. Social factors related to aggression or hurting behavior. Factors related to interpersonal attraction, group processes, how we make decisions in groups. Attitudes, how attitudes are formed, how attitudes are changed. Conformity and obedience, of course, are classic topics in social psychology, as is prejudice. So we've got reproductive psychology, which is my particular focus, social psychology, also an area that I'll supervise in. And then another thing that you might want to know about me is that more and more my research is focused on qualitative methods. So because my research questions often focus on how people subjectively experience events and how cultural actors like media frame and talk about things, those types of questions are suited to qualitative methods. So methods concerned with how people construct meaning. So methods using words rather than numbers as data. So if you're interested in using qualitative methods for your honors thesis, I would probably be a good fit. I'll still supervise a thesis using quantitative methods. This is just something else that I thought might be interesting to know about me. Okay, so I will be there for the question and answer session. If you have questions, please come let me know. Take care.